for them.
Thank you very much indeed for the moment, everyone. Now, shared decision-making is a cornerstone of patient-centered care, allowing patients to actively participate in treatment decisions and align interventions with their personal preferences and values. And additionally, access to support systems and resources can greatly enhance patients' ability to cope with the challenges of living with CRSwNP and also navigate their care journey with confidence. The exciting news is today EUFOREA will be releasing the first edition of the Chronic Rhinosinusitis with Nasal Polyps Patient Guide. Victor, let me come to you. I mean, clearly you're very well informed. How well informed do you think you are?
Well, I've been working in advocacy for 10 years, but I think I don't consider myself a medical expert or anything like that. So I'm well informed when it comes to awareness and working for the patients from the patient side. But
so pretty well. Urquhart, what your thoughts on how much you know, how in terms of the journey, how much do you think you know, and how much more would you like to know?
Well, as a simple patient, I think...
Nothing simple about patients.
There's a lot to learn, and there's a lack of good, simple information about the disease and about how to treat and what it is and what to do about it. So I think when we talk about shared decision making, you can only have shared decision making when you have the right information, and I think EUFOREA helps us to empower us to get the shared decision making going on. So
that's really important. I want to come back to that in just a second. Catherine, just in terms of your experience now, you're in this really interesting hybrid position in many ways. Is there more you want to know?
There's always more you want to know. Yeah. Yes, I didn't have that much information when I started this journey, and wasn't aware of the fact that there was this sort of chronic disease. And even when I asked the doctors and the specialists, you know, what's causing this, I didn't get any answers. And so I went searching Dr. Google. And that's how I...
Very dangerous, very dangerous.
Don't do as I do.
Exactly, I think we spend our lives saying, don't Dr. Google.
I know. Anyway, that's how I found EUFOREA. And it was amazing because I learnt so much from EUFOREA. And then I went to the doctors and said, have you seen about EUFOREA and do you know about this? And they said, no. So I felt I knew more than they knew or that they were telling me.
And Jeff, you're really keen to talk about the relationship between doctors and patients.
Yeah. I want to get to that in just one second, but just in response to some of the other things. You were asking about you know, us if we feel like we have some expertise or knowledge. I was going to say, oh yeah, I was to say, oh yeah, David, I'm an expert in my own symptoms. But I realized that that's not even true, because I've had symptoms that I thought were unrelated to nasal polyps, and that I've discovered that they actually are. And there's just in the work that I do with other groups, I realize there's people have been reporting a kind of dizziness, not quite a dizziness, but a kind of disorientation that seems to be related with having chronic sinus congestion, which has causes some kind of vestibular dysfunction. It was news to me, this was now a few years back, that people had serious hearing loss as a result of sinus congestion. These things.
So you're nodding along, Witzke. Both of you are nodding along and saying, yes, this is true?
Yeah, absolutely. Yeah. Eosinophilic otitis media is a very severe and very debilitating disease that is linked to chronic rhinosinusitis with nasal polyps. And that also can cause the dizziness.
Yeah, I went to see one of my doctors, a specialist, a vestibular specialist, and they never mentioned that. They had no idea what that might have been.
Are you surprised?
Well, it's so, for us rhinologists, the ear is actually an extension of the nose through the Eustachian tube. So they don't want to hear that, the ear doctors. But it's the same inflammation that happens in the tube and in the ear, and that's what you can see. So in some patients it can really be severe, and we see those patients, so we know this association, but it's indeed harder to know, and you have to see many patients. I think we are in a privileged position in universities that we see so many nasal polyp patients that we start to see all the other diseases around.
And Jeff, you wanted to make a point about the doctor-patient relationship.
Before I get to that,
oh, right.
There's something,
you're keeping us waiting.
Something else I wanted to add. You know, I was recently speaking to someone with nasal polyps, and she feels that her polyps get better or worse depending on what phase of her menstrual cycle she's in. So there is a whole universe of things that are yet to be discovered, or not discovered, but explained to people with, who are carrying the disease burden. And I think it's really what we need is a kind of different paradigm, a different way of working together with medical care providers. And it's not going to go back, David, because of the rise in social media, and people are Googling their own symptoms, and I think that's actually a good thing. We don't always have the ability to understand completely what we're reading, but it gives us a foundation to ask some questions. And the way I think about it now, in terms of dealing with issues like this, it's like somebody, there's a mountain to be climbed. You show up at base camp and you think, okay, I need to get to this point, and you can't make it to the top of Everest on your own. You need talented Sherpas to work with you.
Of course.
And I think that for me, the sense is the patient has to prepare themselves as much as possible, present themselves at base camp to talented clinicians who will say, okay, you want to get here, so I can help you to do that. You're going to have to do it yourself, but I can help you. I'm going to be here with you and suggest you the pitfalls and a path that you can follow to get to where you want to get to.
That's a lovely analogy, actually, really good. And Urquhart, the role, Catherine was talking about EUFOREA, that she stumbled across, EUFOREA, that it helped her. Can I just ask you, in terms of the role of EUFOREA being almost that middleman of giving you information that's accurate and where it knows more than many clinicians, how important are things like the instructional videos, the pocket guide, for example?
I think it's really important that those kind of things can empower the patient and ask the right questions and have the right instructions before an appointment. So it's really helpful for patients. I'm worried. My worry is that the pocket guide. How comes the pocket guide to the patient? So. Now we can find them on Google, but in the real world, you want that your GP gives you the pocket guide, and there starts the journey for a lot of patients.
Catherine, perhaps I can bring you in there then. Just as a GP, isn't that right? That actually where we need to be is where, with many other conditions actually, where the GP says, well, here's some information. So whether it's about haemophilia, for example, or whatever it is, hemochromatosis, or whatever it is, surely the next thing is the GP says, right, and here's EUFOREA's guide.
Absolutely, yes, but the GP needs to be informed first. So it's getting it to the GP or whatever healthcare provider you see. That's the important step, as well as the patient.
Philippe, can I just ask you, what advice then would you give to anyone watching this, for example, who is struggling with their symptoms, caught between maybe a primary care clinician who doesn't know a great deal, maybe, and in the ping pong between them and the specialist and trying to access care? What advice can you give them?
I think the problem is there is a lot of nonsense on the internet, and patients start seeking themselves. I see a lot of patients that found me through the internet because I had a lot of publication on the topic. But that's, of course, a lucky shot of those people, and that's not right. GPs can't know everything, and they can't know where the pocket guide is. So I think a good website and good information for patients that is trustworthy without nonsense is extremely important. And of course also not biased, because some hospitals might advocate we have the best thing to do surgery with, but that's probably because they want to do a lot of surgeries rather than to treat the patient in a good manner.
That's a really interesting point. Witzke, can I just ask you, I mean, in my experience of clinical medicine, you really need informed patients. What advice would you give to patients before they go to the appointment? And we're talking sort of belt and braces stuff here about knowing what drugs you're on, what your symptoms are, writing stuff down. What would be your response to that?
Write down your symptoms, all the symptoms, because then together we can go through the list and say, oh yeah, this could be part of the problem and this I can't fit in, things like that. Very important. Write down all your medication, prepare yourself, know what you want to know what you want to ask, because the more the patient is prepared, the better discussion our time will always be limited. So the less we have to sort of teach during a visit, the more time there will be to actually discuss.
And Philippe, finally, sitting here with a group of fantastic patients, is there anything that you would like to add in terms of helping them to help themselves?
I think getting good information from your ENT surgeon is very important, but also for your GP. And well, I think, again, looking on the internet and finding the right information is what we should offer them. At this stage, we don't have this. So I can't say, okay, EUFOREA is now doing that. But we have still a long way to go in making this even more than only just this pocket guide. And so there is still a long way to go for us as a community to help our patients to find the right information. So at this stage, I can't do that. I can refer to the pocket guide, which is a great initiative. But we need to do more. Well, we have to bring more.
I daren't close this without going to you finally, otherwise I will be in serious trouble. Witzke, so just respond to that, but also the journey for EUFOREA has been quite monumental, hasn't it? So where are you now? Where does it need to go? And your concluding thoughts on the role of EUFOREA?
I think for patients, the most important part is be much more critical. You're the one who has the disease. You know, so many patients still are either in the doctors tell me what's best, or in the all doctors are crap. And both is not good. If patients would really help us by being critical, say, okay, you're going to do another surgery, what exactly are you going to improve for me? Huh? That's sort of very simple questions. What's in for me?
So put the doctor on the spot as well. Yeah. And then if I may just finish on the role of EUFOREA, we've heard EUFOREA has been instrumental in the journey for people. It's obviously getting cut through, but it has a way to go. What are your ambitions for EUFOREA?
Well, the most important part is I always look at the diabetes awareness in the world. They have been extremely effective in teaching patients, teaching GPs, teaching healthcare payers to know what the disease is about, to early recognize the disease, because that is a big issue, that it takes so long, so many patients who suffer for years and years and years before they find the right person. So I think awareness is the thing where we really have a long way to go, and that's probably why we have this day here today.
Beautifully done, Witzke. Thank you very much indeed. That brings our conversation to a close. Fantastic discussion and much appreciated. Thank you very much indeed to our patients, to Dr. Catherine Shah, to Jeff Prera, to Ulchart Vels and Victor Gascon-Moreno. And thank you also to our experts, Professor Witzke Fokkins and Professor Philippe Gevaert. Now let's just step back and reflect on what we've learned today. I do think it's fair to say we've illuminated key aspects of how we empower patients with CRSwNP or Nasal Polyp Syndrome to take charge of their health. Now firstly, we explored the patient experience. We recognised the daily challenges faced by individuals living with the condition and the importance of providing support and resources to help them navigate their journey effectively. Then we looked at this from the healthcare provider perspective. We highlighted the crucial role of physicians and specialists in facilitating patient involvement and shared decision making. And it was really clear that by fostering collaboration and open communication, healthcare providers can empower patients to actively participate in their care plans. And finally, we focused on shared decision making and support systems. We emphasized the significance of patient-provider partnerships and the availability of resources to enhance that patient empowerment. And by doing this, we can then really achieve optimal outcomes. What is clear is that by working together as a community, that is patients, healthcare providers, policymakers, and advocates, we can make meaningful strides towards improving the lives of those affected by CRSwNP. Thank you ever so much for watching. I do hope it's been helpful, and see you soon.